I was always good with my hands. I always was able to build things. I could take things apart, put it back together again. I could always see stuff in 3 dimensions. I don't understand why people couldn't do that. I didn't realize that that was a special gift until much later in life. My name is Becker. I'm an orthopedic surgeon here at Penn Medicine. I do joint replacement, basically hip, knee, and shoulder, and everything from primaries to revisions. And revisions of revisions. Like if someone has a joint and say a knee replacement and it's not working well or they have a complication, I enjoy fixing those complications. Some are sports injuries, some are just wear and tear injuries, some are accidents, trips and falls, and some are people just wearing out. When the patient comes to me, when they leave the office, I want them to know what their diagnosis is and what their options are to fix it. Because you can spend an hour with a patient. If you don't give them a diagnosis and a plan, you haven't helped them. My goal is to get them back to what they want to do. So whether that be, playing with the grandkids, playing a sport, just being able to walk without pain, everyday activities, I want to take away their pain and restore their function. We just keep making more and more advances. The parts we use aren't that much different than the parts they used in the 70s. But our treatment around when we do the replacements is much better. We have much better medications that we use, where what used to have someone used to be admitted the night before and they used to spend a week or 2 weeks in the hospital. Now, most of the time we're doing outpatient. When you have a patient that comes into you that can't walk, and then you do the surgery and you fix the problem they have and then they can walk, it's very rewarding personally and also professionally, because those patients are your advocates. Those patients will ask, can I have a bunch of your cards so I can hand them out so someone else doesn't have to go through what I went through? I enjoy both aspects of that. The challenge of making something good out of something bad, and then helping those patients that don't seem like they have any hope.